Hello and welcome to week 6 of health policy here at Salve. And this week we're going to be discussing social determinants of health. This is a field that is rapidly growing and evolving within healthcare, and I think is worthy of its own separate discussion item within this course. And it is something that I've developed a great deal of interest in myself as time has gone on. So our agenda for this discussion today will be a review of what social determinants of health are, the major subject areas that are available within social determinants of health, the major data sources that are in use within this particular area, and how those data sources can be used. We'll talk about some common social determinants of health, or SDOH as it's referred to, use cases. Now, a use case is essentially a real-world application of something, so we'll talk about some areas where you can use social determinants of health in a way to improve the outcome of a decision or a policy initiative you're looking to do. We'll talk about any barriers to adoption of social determinants of health that are currently being encountered within healthcare, and also lead into this week's discussion on the topic. So a couple of reminders. First of all, the research paper final draft is due by next Tuesday. So if you're having issues with that, please let me know, and I'll work with you on that. And also, the group project submissions are due a week after that. So I'm expecting that your groups are working on your materials for your submissions. And if you're having any issues with that, please contact me. So let's talk about social determinants of health and why they are important. So this is essentially allowing you to use a better picture of the patient and the patient's challenges to make better choices within healthcare. Now, this is a very tight integration between healthcare policy, serving a patient population, and data, and clean and good data to be able to inform those decisions. Now, my primary background is data and analytics. I teach a healthcare analytics course at Salve in the fall, something I will look forward to seeing all of you taking part in. And this, for me, is a perfect combination between using data to make decisions that matter for people's lives and for people's outcomes within healthcare. So, social determinants of health is the availability and outcomes. It basically talks about how the availability and outcomes in healthcare vary very significantly according to the social economic factors that are outside of the patient's health conditions. So over 80% of health outcomes are influenced by your social determinants of health, and it's quickly becoming a very important area for healthcare providers, insurers, and policymakers such as yourselves, and it needs to be taken into consideration as you're moving forward on making healthcare decisions. And now these indicators have many factors, including what kind of housing do you have access to, what kind of transportation services do you have access to, food insecurity, gender inequity, racial discrimination, lack of or limited health insurance, adverse workplace conditions, substance abuse. Any of these things can have a significant impact on your health. If you don't have adequate housing, you may be living in a house with lead paint, and you may have issues with that. If you don't have adequate transportation, then it will be important if a hospital is expecting you to do follow-up appointments, but you can't. It is very difficult for you to get there. Appointments then stop happening. Patient's health then regresses, and then you end up with a hospital readmission, or you end up with some other adverse events. Lack of health insurance can have a negative impact on the kinds of decisions a patient might make because they feel that they can't afford it. Personal safety threats can have an issue if you are put into a situation where you might be physically assaulted, or something of that type might happen to you. So taking these factors into consideration is essentially allowing for a marriage, a combination, if you will, of what you would do from a patient, strictly from a healthcare perspective, and keeping in mind any other kinds of stresses or issues that a patient might have in being able to actually do what you needed to be able to do. So this is an area that has been embraced wholeheartedly by a number of health policy organizations, and you do have CMS, the Center for Medicare and Medicaid Services, has issued some regulatory guidance to state Medicaid and CHIP administrators in terms of social determinants of health, and they are making efforts to provide support and services to Medicaid and CHIP to address social determinants of health in areas such as housing services, transportation, home delivered meals, educational services, case management, and the like. So let's talk about some of the primary domains that are within social determinants of health. There are 5 major subject areas that have been identified within social determinants of health. Those 5 subject areas include education, access, and quality. So you have essentially people who have had lower access to education may be more at risk for adverse health events, and the reverse is true. Those people who are of higher educational attainment have shown to be doing better in this area. Economic stability. 1 in 10 people in the United States currently live in poverty, so they can't afford things like healthy foods, healthcare, or housing. One of the problems you often see, especially in inner cities, is the only way that many patients get, or many people get their daily meal, is to go through the drive-through at McDonald's, because that is relatively, if you have a family, you have a bunch of kids, it's often a relatively cheap way to get them fed, but it's terrible food, and it's putting them on the back foot immediately in terms of what may be happening in terms of health outcomes. And so any one of these things around economic stability can have an impact. Having access to transportation can have an impact on these things. So healthcare access and quality is a third area. So how are you able to get to an area where you have high quality services? This is especially an issue in some of the rural states where you may be sitting in a rural town that may be 50 or 60 miles away from a healthcare facility that might be able to provide the services that you might need in a given situation. I've worked with some hospitals down in the southeast, and they have a very, very difficult time serving their population because, number one, they can't get people to work there, and number two, they're just the people are just scattered, and they are too remote to be able to provide services to. Neighborhood and built environment. Many people live in neighborhoods that have high rates of violence, unsafe air or water, or other health and safety risks. And this is especially true for those who are various racial and ethnic minorities. They're more likely to live in places with these kinds of risks. Can cause definite impacts in terms of the kind of healthcare you can receive, and also health outcomes that you may experience because of both of those things. And then finally, social and community context. Relationships and interactions with family matter. If you are living alone and you are in need of assistance, and there's no one around to help you if you've had a health event or a hospitalization, that is something that needs to be taken into consideration when a hospital is working with you. I had a situation a few years ago. My wife and I were living in the Pittsburgh area. Our next door neighbor, who I didn't know all that well, disappeared for about 6 weeks. And then he came back. As it turns out, he was a late 70s Vietnam vet. He'd had a stroke, who had been spending the last 6 weeks in a VA hospital, and they discharged him back to his house. He was literally stuck in a taxi cab and dropped off back at his house, and no one bothered to check on the fact that in the 6 weeks that he was gone, no one was paying his utilities, no one was paying his electric bill. It was in the middle of winter. And here is somebody who has a very, very difficult time even getting around, dropped into a house that has no electricity, no running water, and no heat. And so that is my wife and I did our best to help him out until he got into a nursing home. But it was frankly a disgraceful situation that a person like that would be treated in that way. And that's a failure of social and community context. No one bothered to check that this person couldn't even go back into his house because he had no electricity, no heat, and no running water. So let's talk a little bit about each one of these things. Educational access and quality. People with higher levels of education tend to be healthier and live longer. Children from low-income families or children with disabilities, they frequently experience social discrimination or bullying. They're more likely to struggle with math and reading. They're less likely to graduate or go to college, which means they're less likely to get safe, high-paying jobs, which puts them at risk for greater healthcare problems. Many people live in places with poorly performing schools, and their families can't afford to get them to a good school or be able to get them from that point into a college or a high paying vocational program. And this kind of stress can affect cognitive development. It can make it harder for students to do well in school, and these are all issues that can impact social determinants of health. Healthcare access and quality. Again, access to services. Many people can't get access to the healthcare services that they need, as I've mentioned before. And this could be a result of lack of health insurance, insufficient health insurance, excessive co-insurance or co-pays. All of these things are placing pressure on what a person or a patient could actually be able to do. A lack of available medical services in their area, especially if they live in a rural area, or inadequate transportation to medical services in that area. So all of these things can have an impact on what a patient can do, or what may have an impact on whether a patient can find themselves in a health event or in a hospital, or if they are in need of assistance after they are being discharged. Social and community context. So this is where relationships matter. Your relationships with family, friends, and coworkers can have a major impact on your health and well-being. And many people have challenges in these areas, things that they can't control: unsafe neighborhoods, discrimination, difficulty making ends meet. These can all have a negative impact on your health and safety throughout your life. Economic stability, poverty. Again, in the United States, more than 1 in 10 people live in poverty, and many people can't afford things like healthy foods, healthcare, and housing. One of the problems you often have with people who live in areas that they don't have access to food. I mentioned McDonald's. But you also have a scenario where some of the things could be how close are they to an actual grocery store? In many urban areas, the only quote grocery stores you can get to are convenience stores, where you not only have limited access to healthy foods, but you're paying significantly more for those foods than you would if you were to walk into your local Shaw's or Stop and Shop or Market Basket or Aldi's or whatever else. Employment. People with steady employment are less likely to be in poverty. But people who are unsteady can also make it more difficult for them to be able to find a job. People with disabilities may have an impact. It has an impact on their ability to work. People and then different assistance programs that are available for this. And they can help people find and keep their jobs, and there are initiatives to help people pay for things such as food, housing, and healthcare. But these are all folks who are definitely going to be at risk from a healthcare perspective. Neighborhood and built environment. The neighborhoods people live have a major impact on your health and well-being. Many people live in areas with high rates of violence, unsafe air and water, which is going to present its own health risks. They may be living in a house that has lead paint. They may be living in a house that has poor water or mold, or any of the number of things that can cause issues with them. This is especially true for racial and ethnic minorities and people with low incomes. They're likely to live in places that have those kinds of risks because it's the only thing that they can afford. These are all going to be impacts in terms of people's health. So those are the 5 domains. So how do we identify people who live in those domains? Now, there are a number of major data sources that are available that can be linked with the patient's experience that a healthcare provider and healthcare services can use to be able to make some of these kinds of calls. So there are some of the sources out there include things such as patient surveys. There are a series of what are called ICD-10 codes that can help identify different social determinants of health issues. There are areas within the U.S. Census Bureau, such as the American Community Survey. There's an AHRQ, an Association for Health Research and Quality database that is available. There is a behavioral health survey. It's called the Behavioral Risk Factor Surveillance System, otherwise known as BRFIS. That is a very comprehensive data set that is available. There is current population survey food security supplement that gets into access to food services. And then there's the CDC Social Vulnerability Index. These are all examples of some very strong data sources that are out there that can be used. So let's talk a little bit about some of them. Patient surveys. These are being used increasingly within healthcare systems. They often ask patients questions of if they are having issues with these things. They are some of the advantages of them is that they give you a direct source of information because you're asking the patients directly. They are more up to date and accurate than many external data sources are because they get down to the individual. And I'll talk about that a little bit when we talk about some of the other data sources. But there are certainly issues with them also. The survey is voluntary. Not all patients may answer the questions. They may, especially if someone is living in an unsafe environment, they may not feel they can answer the question, and it causes issues there. It is also prone to selection bias, as those who tend to complete the surveys are often the ones who are least in need of assistance. So you do have issues with that. Patients may not be truthful in terms of what they're saying. You may have a patient not living within a very safe environment. They may not want to say that for various reasons. Sometimes people don't like giving you that kind of information. So there are definitely some pros and cons in working with this. The next piece is what are called social determinants of health ICD-10 codes. For those of you who work in healthcare are probably familiar with this. The ICD-10, the International Classification of Diseases, version 10 is a very substantial code set that is used to identify patients' diagnoses and conditions. And there are literally thousands of these codes going in, and they can deal with everything from a code for diabetes, a code for congestive heart failure, a code for a broken finger with a subcode for which finger, so any one of these things there are literally thousands of these that can help. Now, what happened was in 2021, a series of codes called Z codes were rolled out that can be used to document social determinants of health indicators. So these Z codes are all listed here, and they deal with things such as issues with education and literacy, employment issues, occupational exposure, social environment, upbringing issues. There are a whole series of them, and these are being used at the patient record level, and these are available within most EHR systems, such as Epic, Cerner, eClinicalWorks, any one of those things. Allscripts, I believe also has it. So those are codes that are currently available. The problem with this, first of all, is the codes are often not utilized because they're not tied directly to any kind of payments or anything like that. And another issue should be kind of obvious to you is that this has only been rolled out as of March of 2021. So the data has really only been available for a little over 2 years. So you can't do any kind of longitudinal analysis. You can't follow people over time. There just hasn't been enough time to be able to do this. Now, this problem is going to get less and less as you get more time passes, but you still have issues of codes not being utilized because these are not mandatory codes that are being used. Now, the purpose of ICD-10 codes, especially at the physician level, is that they have a direct relationship to what a physician gets paid for a service. You can think back to our fee-for-service arrangements that were there before. These codes don't have anything to do with that. So the further away you get from the payment path, the less potential reliability you might have within a data source within any of these things. So what's going to need to happen is there may need to be a push to either make the codes mandatory or to get to work on some greater degree of compliance with these. Another very important data set is called the American Community Survey, or ACS. This is an annual survey of 3.5 million households on a very wide range of issues. It's one of the most comprehensive data sources available for social determinants of health initiatives. And there is a lot of data out there about that. I spent a lot of time on the Census Bureau website pulling down these data elements. There is good granularity on these things, and these are geographic based indicators, and many of these informations can get down to the census tract level, which is a high degree of granularity. That it is a much lower level of granularity than even a zip code. So it gives you a very comprehensive source of demographics information, which can be tied to all 5 social determinants of health domains. But the problem with that is it's still summary level at the census tract or the zip code level. So it is not tied to the individual. So you may have an indicator present in a patient's area, but it is not necessarily experienced by the patient itself. So, for example, you may have a census tract which is basically flagged for having low access to people having low access to cars, and you talk to that particular patient and say, "Oh, I see from the census data you live in an area where people don't have access to cars." The person looks at you and say, "What are you talking about? I have 3 cars in my driveway." Because you're dealing with an average, but the person themselves may not fall into that average or fall into that median. The data is complex. There are hundreds of data elements available, and if you're going to be spending any kind of time on this, you really have to have an understanding as to what those data elements are, and you have overlapping subjects presenting what are called collinearity problems. Where if those of you who have taken a statistics course know that if you take data elements that are similar to each other and put them in the model, so if you are analyzing both year and quarter at the same time within a statistical model, you can actually make the model less reliable by doing that. So it's very important to understand this data very, very well. Also, there's a data lag. The most recent data is, I actually believe the data is now, the most recent data is now from 2021. So you're looking at a couple of years out. So if you're looking at an area that maybe there's been some changes in that data set over time, you may not capture all of that. And this is especially important as you're looking at areas which are coming out of COVID. So if you have data, say, from 2021, we were just starting to come out of COVID right then. 2022 may look very different from 2021, which may look very, very different from 2023. I was working with a health system here within my own job, and they were trying to do some dashboard analysis on their ED, and they wanted to have data that went back 3 or 4 years. The problem with that is you're getting right into the heart of COVID, and nothing is comparable from pre-COVID and post-COVID. So having data only coming in right around the COVID time is an issue as well. There's the AHRQ, Agency for Healthcare Research and Quality, has a social determinant of health database. It is a comprehensive source of healthcare information. It is available by zip code. Again, one of the issues here is it's not tied to individuals, and zip code is they're very arbitrary in terms of their borders or anything else. It is also complex. There is also hundreds of data elements available. And it can also overlap with the American Community Survey data within the census data. And we also have a data lag on that system as well. Then you have the behavioral risk factor or the BRFIS data. This is also from CDC. And so this deals with health related. This is telephone surveys that collect data about residents around health related risk factors, chronic health conditions, and preventative services. It is a comprehensive source of behavioral data. I've dived into it, and you can really spend a great deal of time looking through it and understanding it. But on this one, the granularity is even lower than in some of the lower than some of the others, where the results are only available by county, and it's also, and again, it's not tied to individuals on that. So if zip code information isn't granular enough, then county information is even less so. So there are definitely issues with that. Then you have the Population Survey Food Security Supplement. This is out of the U.S. Department of Agriculture, and this gets into issues around food security, which definitely has issues with social determinants of health. And so that's definitely an issue for it, but it is a fairly small sample size, and the most recent data I believe is also 2021 now. Then you have the social vulnerability index. This is coming out of the CDC. This deals with a negative impact on communities caused by external stresses, such as human-related disasters or disease outbreaks. This works directly with the social and community context domain. Here, but this is a sample data. It's a relatively small sample size, and again, the data is only available by county. So now you have this is a different source. There are companies out there which collect consumer behavior data. So this is you can get access of every single individual in the United States talking about their consumer data, and you can figure out if this gets down to the individual. You can figure out, have they bought a car within the last 6 months or 12 months? And you can get into other kind of purchase decisions or any other kinds of information in terms of the individual's demographic and geographic profiles. So this can get you down to the individual. The cons are this data is expensive. You have to pay these companies. One of the common sources out there is called Wunderman Thompson that has access to this data. The data is expensive. The matching can be difficult because you may have a name and a date of birth, and you have to, or some other combination of things, and you're trying to deal with matching that to a patient database where all of the data elements may not match exactly. So you may have to do a combination of probabilistic and deterministic matching to be able to figure out that the person on the consumer data record is in fact the same patient you have within your own system. Now there's also massive quantities of data elements available, and you have to really understand it well if you're going to see the forest for the trees. So let's look at some common social determinants use cases. So the use cases that you could do with this really are only limited by our imagination, but I'm going to go through a couple. Discharge planning and follow-up, readmissions reduction, care coordination, population health, public health facility locations. These are all potential combinations for social determinants use cases. So let's talk about discharge planning and follow-up. Adequate discharge planning is crucial for ensuring high quality outcomes post discharge. Where it can help is that the data can play a key role in discharge planning, as it takes the patient's potential difficulties into account. So if you're going to have a patient, so if you want a patient to come into a PCP office on a weekly basis for follow-up, but that person doesn't have a car, and you know now that person doesn't have a car, you can plan your discharge instructions accordingly. Or if that person lives alone and they don't have, it's going to be difficult for them to stay on their medication. That's also a piece of information that you may want to have. Readmissions reduction. Inpatient readmissions are becoming a huge problem within healthcare. And this is causing greater scrutiny by both government and private insurers through increased penalties on hospitals. Social determinants of health can help from everywhere to how the patient integrates with the pharmacist, how the patient integrates with the care coordination nurses or the case management nurses. Understanding what that patient may be going through can have a huge impact there. Care coordination. So the main goal of healthcare is to make sure the patient needs and preferences are out there for high quality and high value healthcare. So social determinants so essentially care coordination involves making sure that you organize patient care activities and information in a way so that the patient receives the right care in the right place at the right time. Social determinants of health can help provide that. Population health. This gets into some of the value-based payments scenarios that we were discussing last week. So integrate social determinants of health into value-based care can give you some important insights in terms of figuring out what a patient's benefits design and coverage might be, and that the health plans can be a part of the effort to improve those patient health outcomes. So this will allow you to make your value-based care initiatives that much more successful. So the readmission reduction, I do want to go into this a little bit differently. This is essentially how you would go about merging data sets together. So you would get data from external databases, you would apply scores to that data, you would merge that with, say, claims data, you would then merge that, and then that gives you your set of patients that are potentially at risk. And then as you are dealing with patients within your own facility, you'll be getting what's called an ADT feed, or admit, discharge, and transfer feed. You merge that ADT data with your at-risk patient data, those patients who were potentially at risk and post-discharge, the social determinants of health factors, and then also integrate that with consumer data and consumer data elements that can then provide information to your staff who are providing targeted assistance to those patients, and be able to bend the curve in terms of giving them better outcomes for social determinants of health. So what are some of the barriers to adoption for social determinants of health? Some of the key barriers are, first of all, there's a perception that these tools create a fragmented view of the patient. You have relevant data in some places, not in others. In some cases, you try to get people to capture social determinants of health, and the workflows get very, very time consuming. So you may have some patients are served and some patients are not. The ICD-10 codes that I mentioned before, the Z code list is not universally adopted, so there's potential for gaps there. The census data sources have got time lag and granularity issues. The consumer level data has cost and complexity issues. So those are all some barriers to social determinants of health. But this is an area that I believe is vitally important to being able to get right and to understand as we try to make our healthcare system more accessible and more inclusive and more equitable to everyone, really. So that basically wraps up the discussion on social determinants of health. So I would like to, our discussion for this week is to discuss how policymakers, and that includes you, should incorporate social determinants of health into strategic and operational decision making. Many of you work within healthcare. I'd like you to think about how you would use this information yourselves, or how you may have already used this information yourselves in terms of any kind of strategic and operational decision making. So I'll look forward to hearing your responses on that, and I'll look forward to speaking with you soon. Thanks very much.